By now, a lot of you are probably aware of the big respiratory illness, Enterovirus D68. It's been making its way through the U.S., particularly in the Midwest, though it has not been confirmed here in New Mexico. However, doctors and health officials say it probably is just a matter of time. So here to talk more about that, what you can do to protect yourself and your kids, and a little bit about the flu shot is Dr. Felipe Zanghellini with the Lovelace Medical Group. Dr. Zanghellini, it's good to see you again. Good morning.
Good morning.
Okay, Enterovirus D68. This thing is not new, but it's become quite common in the Midwest within the last month or so, right?
It's not a new virus. It was first isolated in 1960, and it's not very common. Since that time, probably has caused 100 cases, and right now we don't know why it had become so prevalent in the Midwest.
So it's interesting you say 100 cases since the 60s. Now we've had hundreds of cases of kids getting hospitalized just within the last month or so. And you say this is what's kind of worrisome about this is you don't know where this came from or why it's popped up like this.
We don't know why. We don't have clear reason why it has become so serious and so prevalent, you know. So we are hoping that this is an isolated phenomenon in the Midwest, but it could be that it could spread to the rest of the country too.
Okay, talk about the idea. It's not confirmed here in New Mexico. I believe they were sending some samples to be tested from one hospital here. Is it likely that it will be here simply because we know it's in Texas, we know it's in Colorado, and these viruses spread pretty easily?
I will say that most likely we'll get here too.
Yeah.
Like you said, it's in Texas already and in Colorado.
So what are the symptoms? How might parents and children and others know that maybe this is something they have?
Well, enterovirus can cause different symptoms. One can be fever, just plain fever, headache, cold symptoms. Sometimes they can have vomiting and diarrhea. You know, the more severe cases that occur in the Midwest have been in patients with asthma. But everybody can get infected from this virus. It's more prevalent in infants, children, and adolescents because they have not been exposed to the virus before. So they don't have the antibodies like adults that protect them against the virus.
Okay, how would parents know if it's time to take a child to the hospital if they might have it, as opposed to just saying, okay, you got a cold or you got a virus and you're going to be able to beat it on your own, as opposed to you need to go to the hospital to get some help?
Well, if they notice that a child has cold symptoms and he is not eating, he has a very high fever, he's having symptoms of respiratory difficulty, the respiratory distress, I think that they need to get consult. They need to get advice as soon as possible. Okay.
Is there a vaccine or anything for this right now?
No, we don't.
You don't?
We don't have a vaccine. Right now, what we recommend is to wash your hands.
Sure.
You know, that is a good way to prevent any kind of infection. You know, avoid touching your eyes, your nose, or your mouth with unwashed hands. Avoid kissing, hugging, or sharing utensils with people who could be infected. And disinfecting surfaces that could be contaminated with the virus. And seeking attention when needed as soon as possible.
Okay. Now beyond that, we're getting close to flu season here. Flu shots are out. I know you doctors highly recommend them.
I do.
Yeah.
I think that I could not be more emphatic in recommending the influenza vaccine. The influenza can cause similar symptoms to Enterovirus D68. So one way to help you to differentiate is to get your influenza vaccine as soon as possible.
Yeah, I see the signs out. A lot of pharmacies, a lot of clinics, a lot of doctors' offices, they already have them. Is there any reason you would not get a flu vaccine?
Well, there are some cases, you know, like egg allergies, that the vaccine will be contraindicated, but those are very rare. You know, and the influenza vaccine is a very, very serious disease. I mean, it kills more people than any other infectious disease illness in the U.S. every year. You're telling me a minute ago you got the flu once. Not a pleasant experience. No. And the good thing is, I mean, it's easily prevented. And there are even free clinics that'll be coming up at UNM and at other places all across the city that if you can't afford to get one of these or you don't have insurance, you can get them for free. The vaccine is very effective. Many people say that they get ill when they get the vaccine. Is there any truth to that? No. No? Is it just kind of you get it in your mind? When you get the injection, you are getting a kill virus. I mean, your body mounts an immune response. You get symptoms similar to the flu. But I had the flu one time, and I can tell you that it's nothing compared to the symptoms that you get from the vaccine.
All right. Always get the shot. Dr. Zanghellini,
yes,
thanks for coming back. Appreciate it. Good advice. If you want to find out more about what he's talking about, both of the flu shots and about the enterovirus, head to our website at krqe.com. Click on links. Come back soon, Doctor.
Thank you, sir.
At 7:30 right now. Stick around. We'll be right back.